Welcome everyone. Today we have another new episode. Basically, we do discuss about the healthcare system, especially the healthcare situation right now. So we have our guest, Mr. Jem Eid. He is from USA, as well as we have our honorable guest from Finland, Mr. Ika Kako. I think both of them already joined in World Talent Economy Forum. We have our another guest, Dr. Churchill. He is a professionally doctor, so that's why I think he can come up with some of the idea. And we just get the practical experience, what's going on in USA, what's going on in Europe. So I want to start with Mr. Jem Eid. So how are you? How is everything?
Everything is wonderful, in my life, but not necessarily wonderful in everyone's life.
Yes. So what the situation right now in USA after the elections and everything? What the COVID situation right now?
Well, many of us are cautiously optimistic because we have had the experience of denial that the pandemic has been as impactful as it has been. And it has affected millions of people in the United States. And we have suffered over 250,000 deaths because of the pandemic. But the message that we were getting from our leadership was that we're turning the corner, it's going away, it'll magically disappear. And now, as a result of our elections, we have someone whose belief is in science. And he is taking advice from the medical experts in the scientific community. And we are now hopeful that we will address the tragedies that are happening on a daily basis in the United States. So based on the results of the election, which was a very contentious one, we have some cautious optimism. And the idea that there's a vaccine in our future, we have some idea that we will be doing better in the future. But right now we're in a shutdown and we're in stages that we call, orange, red, purple. And most of California is in a purple stage, which is the ultimate shutdown. So businesses, restaurants, things of that nature have to close. And whether or not they will be able to stay in business to when we can reopen is a source of concern.
Excellent. Mr. Ika, what's the situation in Finland? What we can understand from the European system?
Well, Finland itself, we have managed with the pandemic very well so far. So we have been one of the bright spots in Europe. So actually, we have only a minor population of 5.5 million people, and our population density outside Helsinki metropolitan area is very low. It's very low. We have a lot of countryside, a huge country with 5.5 million people, out of which 1.5, 1.7 million are living in Helsinki metropolitan area. So we have all our figures are really good still, but it's becoming worse now, really rapidly. We are now hit by the so-called second wave of pandemic here in Finland as well. But Europe itself, there are countries with real trouble in Europe, like France and UK and most of the European Union countries are now suffering very heavily about this. But as I said, Finland has managed to do very well. We have only less than 400 deaths, and like I said, compared to our population 5.5 million, that's not much. We have a daily cases around 250, 300 cases per day, only new cases. So, and our healthcare system is very well prepared. So we have quite a lot of hospital places and also these emergency hospital places and beds. So it looks good, but it's getting worse.
Yes, I understand. So, Mr. Jem Eid and Ika, I just want to ask you, what do you think? What will happen in the health, especially in the COVID period? Because right now we have many challenges. There are many people, those who have a lot of problem and lot of challenges. right now, especially economic challenges, healthcare system challenges. Do you have any creative solution in your minds? Do you think that how governments and the peoples and the corporation, they can solve this problem in a effective way? Yes, Mr. James.
Okay. I have my own personal opinion, but this is a layman's opinion. It is not backed by science or medical training. And what we have seen in the United States is a tremendous impact on the frontline healthcare workers. Our hospitals are overcrowded. People are being turned away. People are being by ambulance taken from one hospital, cannot admit them to another that may be able to. So it's quite, in different regions in the country, it's quite shocking what's going on. And the frontline nurses, the doctors, are stressed beyond our comprehension because they just go from one patient to another. And you imagine caring for someone and then having them pass and then having to turn around and care for someone else who may or may not live. And so this is a daily experience. And it's okay if it's a day, if it's a weekend, but if it's month, that's almost too much to imagine. Yet it's been 7 months and more, and there's no end in sight. So what we have to do is protect our frontline workers, give them everything that they need, and put the government resources to work to supply them with the equipment that they need. And if we can do that, then the question is how can we house the people? Because we have 1,000 to 2,000 cases a day, and in some regions are hit more heavily than others. It's harder for them to cope. So we have to give them the resources to cope. And if that means building something, we've converted soccer fields, we've converted arenas for places for them to just physically exist and be taken care of as best we can. So this is not something I can minimize. This is something that is beyond comprehension, what is going on in certain parts of the country. The toll it is taking on our frontline care providers, the number of families that have been affected by someone in their family that has passed away or is in danger of passing away. So there's really nothing that the government should hold back. It should be going all out in order to help these frontline workers. And I think we now have the will to do that. So I'm guardedly optimistic.
Thank you. Mr. Ikakako, how do you want to analyze the present situation?
Well, I would like to see the positive side of this, and I have to emphasize that we are not hit that much than most of the countries in Europe and in US, for instance. Our frontline workers doing also a brilliant job, but we are not in a stages that it's going to break down. So it's like everyday business. Of course, it has affected the treatment of, I would say, more other diseases or operations or this kind of things. So we have kind of creating a queue for those operations which now have been kind of dismissed and so on. And that might take time that everything is in normal again, if anything is in normal again. But I would, and the other thing is that this economical side, we have been hit. Our GDP was down by about 10% in last quarter, which was less than in average in Europe. But we were, I would say, prepared and in a way lucky, because in Finland the remote work has been very useful. We have used it a lot even before COVID, and now when companies started and businesses started to move from office work to remote work, we had everything on table, and everything, the equipment and the attitude and this kind of social response also to that. So we did it very fluidly. And my positive point here is that probably this COVID will end up for the improving the conditions, working conditions, that people can work blended work, so they can work from office and from home, this kind of hybrid solution, which will then again decrease the amount of cars on the streets, and all this kind of, commuting will be less and less. And so, and overall, I think though, and we had some also some studies here in Finland that overall people felt more happy now when they had the chance to work from home. Also, we had this period, short period of time in the spring when also the schools were closed. And then many people with families, they were really strained because they had to take care of their kids, work in the school at home, and then they had to work from home to the office.
Yes.
So that was really a stressful period of time, but even the experiences from that time were mostly positive. And now when we have a different situation, that we have still, our schools are still open, so people can work from home and the kids are in the school, so the situation is now better. So I expect that this will cause a permanent move towards more sensible way of working.
Excellent, excellent. I have one thing in mind. Just example, World Talent Economy Forums, we are actually a intellectual hub we are developing. We do more work on education, healthcare systems, as well as good governance. We do a lot of research. Research is our first priority. Beside that, we do hardcore consulting. My issue is that for education arena, because education is very important for every nations, most important thing is that many developing nations, there are many students go for the dropout, many students,
Yes.
because of the COVID situations, because of the financial issues and many things. I think it's around 28%. My question is that for the education example, how we create better ecosystem for students, for teachers, researcher, as well as for the corporations. Do you have anything in your mind, or we can work something together? And beside that, in healthcare systems, like example, we are observing that healthcare system has a lack of human resources, especially doctors, good nurse. Example, in the developing nations, there are yes, Malaysia actually doing very good in the COVID situation. They handle the COVID situation very well. I think their death rate and everything is very low, as much as possible. But beside that, how we can develop the, first thing, this online strategy, and second things, this healthcare's like frontliner people. What your advice? What's your analysis? Mr. James, then Mr. Ika. Yes.
Okay. All right. I did want to just really second what Mr. Ika has told us about the impact on the work environment. But what I do believe in the healthcare industry and the education industry, these are things that are, I would say it's not an overstatement to say they're broken in the United States. And we are in the process of trying to reconceptualize how we can fix them so that they function better. And I think that when we talk about remote access, we have to remember that at least in the United States, there are large populations that have, if they have computers, they have no Wi-Fi. If they have Wi-Fi, they might not have any computers. So we have to have, I think, facilities around the country where people can go to access online education, to work remotely, where they can do social distancing and still have access to these things. Because we, some of us, some parts of the country, it's just taken for granted that you can access the internet and look at videos and do work. And in other parts, it's not available. So we have to solve this problem first. I think if broadband access was widely available, many of these problems could be solved in a more creative way. But it is not. So let us put our emphasis, our energies into making it available so that the whole country, the whole world can become connected.
Yes. Mr. Ikakako, how do you want to analyze this point?
I would like to focus on the education point, because I have to say I'm not that familiar with the healthcare, work and healthcare conditions on the front line. For sure that to put the one comment there, it's probably one of the least favorable areas for remote work. So you need your personal, presence there. Also in this kind of diagnostics and later on, I'm not talking about COVID itself, but this kind of remote diagnostics and everything will be developed when optics and this kind of instruments will improve, and the connections, what James said. So that's also partly the situation in Finland, that even though we have great networks, but in a more remote areas, they are not working that well. For instance, if you are watching a video or that kind, you might have some troubles to get it smoothly done. So that's always the question. But from the education point of a student point of view and also teaching point of view, I see a lot of possibilities as well. So in Finland at the moment, for instance, most of our universities are now again in remote mode. So the students are not attending the university facilities for anything, and that has, of course, this kind of social effect that when people don't meet each other, there is not so much trust building and friendships and this kind of thing. So that might affect. But on the other hand, if we start to think about this, in a longer run, you don't have to be how would I say, you don't have to depend on your own university. So all this curriculum from different universities, these so-called MOOCs, MOOCs, and then they are then in your usage. So that might also help that the content and the quality of the teaching will improve, even in developed countries and more so in developing countries. So I can see in 10 or 15 years from now, I could see that when people start to study, they can choose the curriculum from different universities globally, and that would be really, I think, improving the situation as such, as well as also the remote work, because if you work remotely from home, you could as well work remotely from Bangladesh or Indonesia or Seychelles or whatever. So that might change a lot in our working culture as well, but also in education.
Yes, I think Mr. Mika, you're saying something that is very important in terms of the student's experience. The possibility, the positive side is this menu that they can select from in order to get the education, and the downside is the lack of social interaction with their peers. And also, I would like to ask you what if this is true in Finland or in your experience. My friend was a professor at Stanford, and now he's part of it. He's an associate dean in the economic department, and he's finding that his day is gone longer. He's working harder than ever because there is so much to coordinate. And is that your experience as well?
Mhm.
Most probably that is the case, yes. So it's really demanding work for those professionals who are doing the teaching or planning the programs and all this kind of stuff. But at least the frontliners, I would call them as well frontliners in this case. So
Mhm.
so that will be changing a lot for sure. Yeah, good point.
Yes, yes. Thank you. Thank you. We have our guest, Dr. Churchill. Can you hear me?
Yes, of course. Hi, how are you, Sharif? Hello,
Yes, yes,
James, and hi, Eka.
Hi.
How are you
yes,
guys? It's good
yes.
to see
Ev-
you all this morning. I,
And you as well.
thank you,
Yes.
thank you.
Yes. Dr. Churchill, like example, you are actually healthcare workers and you have a very good knowledge about healthcare systems at this point. So how do you want to point the present situation? How do you want to analyze the present situations? And what do you want to share?
Well, since I come a little bit, later in your discussion, I would like you to kindly signpost me to the exact place that you want my input at. It's a
Mhm.
vast field.
No, definitely. We are in that area. That example, my friend Mr. James, he's actually come from USA and he tried to analyze the US point of views. Mr. Ika from Finland, he's trying to figure out the Finland point of views. And you are actually healthcare expert.
Yes.
So I want your opinion, especially for the healthcare systems, how we can work together to overcome from this COVID-19 situation.
Thank you. So it is about this epidemic of
Mhm.
the Wuhan coronavirus. The case that we are facing is quite obvious, and the most important uh, element to this, I would like to caution people that we must remain calm, regardless of how the approaches are working or not working. We must, just take a deep breath and do not panic. In my country alone, in the United States, we have experienced more than 200,000 deaths that are somewhat related to COVID. Awful. And yet, there is another more difficult reality to stomach, and that is 1.2 million suicides due to the reaction, or rather the overreaction that we had for COVID. So you put the two things in the scales of justice and human behaviors and certainly health systems, and you find out there is a certain deal of injustice because the lockdowns, the social distancing, the disassociation of humanity, the breaking up of our communities, our incapacity to come into common places of worship, our unwillingness or our rather the lack of permission to even get within each other's sphere to share something that is so vital to human beings, such as a hug and a kiss, as so important. And we do know that when we lack these things, the most fragile amongst us, and in some cases, some of the most brilliant people, they say, I can't do this any longer. And the suicides are not just soaring, but they are also being hidden from public view because it's kind of difficult to ascribe somebody to COVID death if they jump from the 16th story window or if they overdose on fentanyl, as is the most common way of suicide amongst young people in colleges and universities that are closed up because the teachers and everybody else are unwilling to perform their duty. Same goes for the churches. The churches that have been the traditional, and I mean, the mosques and the synagogues and everything else, the places of worship that have created to begin with the human society are being, lacking imagination, and they're calling people to do it from their home via Zoom. How is that going to support anyone? I do not understand. So when we have 1.2 million suicides, I have to stand up for these people and say, this is not just unfair. This is completely wrong. So I would say, let's pay a little bit of attention also to the base of the pyramid, to the millions of people who have lost their jobs, their livelihood, who don't have enough food on the table for their children, and they are going homeless. You look at any of our cities in America, and you see them, just strewn up with a beautiful humanity in these flimsy tents in the middle of the winter, that kills, left and right. You try to live in a tent that's unheated in the middle of the winter in Chicago, or try to live, in any place like that in the big cities such as New York or DC or anything else that's even way colder than that, or in Seattle, my town. And I will tell you, your chances of survival are slim. Not only because of the elements, but because you will find your life to be threatened, that you would say, enough is enough, I'll take it my own. So I will speak for the 1.2 million suicides, and I would say, this is a grand indictment against all those governors, against all of those mayors, against all of those, people in public health who, from places of wealth and protection and living in their nice big warm homes with Amazon delivery prime time every day 3 times, we don't care. And I speak that now to Mr. Gates and Mr. Fauci and all those people, who have bollocks for a brain. And they do not understand that the humanity we care for is the bottom of the pyramid, is the many millions, because these people support our societies. And when they don't have a job, in the closest restaurant, or when they don't have a job in any facility they've been employed, we are causing direct harm to our society. Because, as I said again, the bottom of the pyramid is who builds the pyramid of our societies. So the people in the top, they can enjoy their privilege, their wealth, and their supremacy. So I must say, I'm very much looking at a revolution of some kind that will shake up, this tree of iniquity. And that revolution is coming already, as we see from the people who are saying, we won't be part of this any longer. So I expect great things to happen, and I expect that our health system could be shaken up so badly that they would have to be reconfigured. I'm experienced, educated, and worked both in the East, in the West, and in the center. So I do know how to do these things. I started my first health clinic in the refugee camps from the wars and the displaced people in all of these wars that America gets involved into for purposes of energy and oil and whatnot. And I know how the people, of course, in my case, over the last 30, 40 years, have been dealing with tuberculosis, which is still the number 1 communicable disease killer by far. And it is not a Mickey Mouse virus, like this coronavirus that only kills 0.02% of the ones who are affected by it. It is a real killer because we don't have antibiotics to address it. XDR-TB, which means extreme antibiotic tuberculosis, once it goes to the lungs, it has an attrition rate of 57%. And that is higher than the Ebola virus. We don't talk about it. Why? Because the rich societies are not affected by it. Our good nutrition so far, our good health care, that we can manage so far, has separated the global south, which we call the tuberculosis zone, and there is a lot of it down there, from the global north, or rather the developed world versus the third world, as we used to call it when it was not politically, unkind to call a spade a spade. So I'm saying that having worked for 40 years with TB, XDR-TB, MDR-TB, and TBR-TB, that none of the vaccines, address, none of the antibiotics handle, I've come to a good and serious conclusion that the worst amongst us, the poorest amongst us, the ones at the total bottom of the pyramid, the homeless, are the arbiter of the health of a society. If as a society's leader in healthcare I cannot take care of those people, I am not interested in taking care of the health of Mr. Gates, Fauci, or anybody else, who is harping about, oh my God, the sky is caving in. It is not. So strengthen up, buttercups, and become, a little bit stronger in your beliefs, and try to understand that this thing is just a minor inflection in the healthcare systems. We've got bigger fish to fry. I want to care about the young people who commit suicide because they see no exit out of this awfulness. And although, the coronavirus kills the very elderly, the people who have a lot of systemic disease issues in their systems, in their bodies, unfortunately, suicide is the predominant domain of the very young and the very despondent and the ones who have been displaced purposefully by this very wealthy response, a response that comes out of the sobriety of privilege, a response in our healthcare systems that say, that let's take care of the wealthiest amongst us and forget about the poor. And I tell you, just look in history and tell me how well that worked out during the French King's son and Marie Antoinette, and how they ended up when the peasants came out with the pitchforks because there was not enough bread. Certainly there was not enough cake to go with the tea. So I suspect, we are going to see some momentous changes, and they're not just going to be on the healthcare system. Our societies will be upended. And in that respect, in that unintended consequence of our awful response to the coronavirus, I will salute history, and I would like to be at the ramparts and at the forefront of that revolution, holding the flag of equity and holding the flag of justice for the bottom of the pyramid people. Not for the wealthy ones, not for the ones, who are just too afraid, to wake up and face the sun. And like the blessing goes, I wish to say a prayer for our people. Face the sun, and do not be afraid. Do not lose heart, because the good God wants to save you, protect you, and prosper you. Suicide is not an option. And when all is lost, and when you don't see, light at the end of the tunnel, pray, just pray. And that is how to address that, I do not know, except to say that we should make, a very big public appeal to save the psychology of our people, the psyche, to cure and heal and love the psyche of our people. And give a hug every once in a while, because a hug maintains a person, and a hug, gives you the strength that you do not find in this awfulness of social distancing. And if for children especially, this is one of the pivotal times to consider that a hug can save a life. Do not be afraid. So love each other. That's my advice.
Thank you.
Dr. Churchill, that was amazing. I'm sorry to cut you off, Sharif, but I just wanted to commend you for how articulate, eloquent, and passionate you were in communicating that. Because this phrase has come into our lexicon now, hug deprivation. We are deprived of the hugs. And so we now can speak about it, but only through Zoom. We can only talk to each other through these video devices and say, yes, I would need a hug. Well, I cannot give you a hug through Zoom. So, but I just wanted to commend you for saying that. And from what I gather, if I'm hearing you correctly, you do not think that the results of the election are going to matter so much, even though we're now going to focus on science and medical advice. This will not be enough. Am I hearing you correctly?
I actually would say that this is further decrepitude of our healthcare system, because the people who are now in power fully are the ones who like to separate themselves from the hoi polloi and find safety in their redoubts of wealth and privilege, masking themselves behind health and safety in a very wrong way. So no, my friend, I don't see, Mr. Biden, giving a hug to anybody. He's so fearful, of anything and everything and of the people. And I suspect none of his people would either for a very long time. So I think we are going the wrong way, and this thing needs to be shaken up, However, there are promising signs in the sense that the people are not any longer interested for who is at the helm. They are looking at their local community to support each other. And I have been going, and helping out at the food banks, and I see the multitude of humanity who shows up not just to accept the handout, but also to give. I see people coming up and they're depositing a couple of turkeys for this Thanksgiving, and they say, take.
Yes, Mr. Ikakako, how do you want to add from the European perspective in this discussion?
Well, thanks, Dr. Churchill, for your perspective, which is, I suppose, pretty US-centric in this discussion. I can't really recognize that situation here in Finland, because we have so-called welfare state where nobody is really left over. We have this taxation system, and we have free education, we have free healthcare, we have this kind of infrastructure which we have been able to fund by the taxation of our people and companies. So I don't really see this happening in Finland. Nobody is over here in Finland, and I think that might be even something the Scandinavian countries, Finland, Sweden, Norway, Denmark are famous of. This kind of democratic system where which is also justified, and there is no such I would say in such amount of this kind of inequality, like you say. Most people are getting the food on the table, they are getting their houses heated, they will get some nursing if they need, and it's not the question of the money what you have got. So I don't really, because I don't know the US situation. I very seldom visit US, by the way. I'm more Europe centric, and I visit Asia and Southeast Asia and Africa more often. So I have many times wondered the situation in US, and not depending on the presidency. The system itself is what it is, and I don't comment more on that. But I'm just proud and happy that we have this kind of welfare state here in Finland.
Yes, thank you. This is very interesting discussion. Besides that, as Europe has different system, Malaysia has different system. But one thing I can share, the Singapore, Malaysia, every time they are improving, they are actually, and this time they are showing their capacity, that how capacity they have, even though compared to USA, actually, we are very small, but definitely like they are trying to solve different kind of problem with their own way. But my question is that how do we work together for the global goods? Like how we can create more, example, vaccine. I know many people, maybe they are not capable to buy vaccine. Maybe for US it's not a problem, maybe for Malaysia it's not a problem, maybe even for Finland it's not a problem. But example, there are many people around the world, maybe they cannot buy vaccine. So what will happen in the next few years? What's your predictions, or how we can create some good global collaborations for the healthcare system, for better education system, or how we can develop better policy together?
Well, I think that comes right up, to the central issue. Are we having equity in our society or not? And I'm afraid that this epidemic has exposed our tremendous flaws. In the United States now, we have 50 million people not on the threshold of poverty, but steeped deeply into abject poverty. It's not just the homelessness, it's the people who are proud, poor, and they still basically maintain their home, although they haven't paid taxes for years, and they're in foreclosure and they are threatened with evictions. Many evictions are coming to the United States with this Biden administration being unwilling to extend the evictions moratorium simply for economic purposes under the guise of some kind of democratic enlightenment. So I am suggesting that the United States, not being an equal society like Finland, but yet again, there is no such society that's so equal as some of the Scandinavian societies. And I applaud those societies, but they are very small to matter. 10 million here, 15 million there, 11 million the third one. So you've got 3 Nordic countries made up of mainly the descendants of the Vikings, and with a sprinkling of a few immigrants. Ha ha ha. Forgive me for the pun, of speaking of our Finnish ancestors and the navigators of the Baltic Sea and beyond. I very much like, the old Hanseatic League, that it was not just a trading concern, but the Hanseatic League centered around big important port cities of the Baltic states and the Scandinavian. It created a tremendous amount of care and wealth for everybody, because they knew that if they cannot take care of the sailor and their families, they would not be able to have captains and boats, plying the seas for trade. And I suspect the same would be my advice for the United States today, which is a deeply unequal society and it's getting more and more unequal. And although I am the American Churchill, I'm very well steeped in the reality, having worked in the field of healthcare, providing succor and support for people throughout the world in all the refugee camps of any war that erupted due to our country. I'm trying to pay my rent here for being on this lovely planet of ours, with all its difficulties, and sharing, God's message that, be your brother's keeper. Don't be your brother's oppressor. And in the United States, we haven't gotten through to that yet because we don't even have a decent healthcare system for all the people. So the 50 million people I spoke about before the other threats, not only they will not be able to afford the vaccine, they don't have any healthcare to speak with. So clearly, they are being left alone. So how can you address an epidemic if you don't treat the people, freely? If the vaccine is not available freely for everyone, should they wish to take it? I'm not saying they should, because, you have to judge the merits of it. And I must say that you look at the other systems, that they are descendants of a different political system and a political economy. And you look at the old Russian system, which is a product of very good science that addressed the needs of the people for very many long years of difficulty, all the way back from, the beginnings of the revolution of the people in 1917 through the Second World War and so on. And they were experts in vaccines. And that's why Russia has had a vaccine for 5 months now that has quite a good efficacy rate, maybe 92%. But do you see Russia, sharing it with the rest of the world? Not, because they don't have enough to produce for their own people. And the same thing with China. China has had a vaccine for a while, but have they shared it with the rest of the world freely? Not. And America is developing one now, but supposedly, it's going to be done in a month, in 2, in 5 or 6 months. I do not know. I can tell you that we are well behind, and that is manifestation and proof that United States and Europe, by the way, Old England, Oxford University is working on a vaccine, It's not just Pfizer and Moderna in the United States, there's other companies and university concerns. Are they going to be ready in this year? I suspect not. So why is this discrepancy when you have one country, that has a vaccine for 5 months inoculating its citizens, and 2 countries, actually, both China and Russia, and they are very big, and they have to take care of their own. And that proves simply this: when the stakes are high, everybody looks to their own house. And it's rather unfortunate that my country does not. They talk a lot, and the United States does not have a vaccine to this day, and it follows Mickey Mouse medicine, total stupidity and utter absurdity in destroying the lives of the people in the bottom of the pyramid, further diminishing them instead of supporting them. So I have to say a big indictment here, because the first thing that I did when we created some kind of medicine for the new forms of tuberculosis, and that was we were able to see that it works, and we got permission from the European EDA, the Medicine Association, and then we got a fast-track approval for this cocktail of antibiotics from the FDA. I put it on the internet, and we open sourced it on the 15th of August of 2019, simply because I thought that the poor people should have it for free. It's very easy to compound it, instead of having, an expensive company that it would never give it to the people. So that way, by putting it on an open source license on the internet, the people of Guinea, the people of Ghana, the people of Nigeria, the people of India, the people of South Africa, and the people of China and Latin America, Bolivia, I know, for example, there was the first country to start producing this new anti-tuberculosis, cocktail drug that I and other people from the non-profit world, we compiled. We never gave it to a medical company, to a pharmaceutical, so they can make money out of it and deprive the people. We just gave it for free to every country, to every people, to be able to compile it with the internet. So what I'm saying is we have technology today that we can share the same elements for the vaccines that already have been developed, but I do not see neither Russia nor China doing that for the benefit of the world that suffers. And I suspect America will not do that either, because Pfizer Moderna and everybody else will want to make money. And so it goes with Oxford, because they're associated with a public company, although I do have a hope that my old university will put it out for the people. I don't know.
Well,
if it's up to me, I will definitely open source it on the internet so that I get my hands on it quickly. Ha ha ha, keep that a secret. Don't let anybody know.
Well, Dr. Churchill, I'm shocked. I'm shocked that you're suggesting, if I understand you correctly, that the free market society is not applicable to medical problems in all cases. Is that what you're saying?
I'm not just suggesting it, my friend. I think I've given you live examples of this,
Okay, but just I want to add on one point. Nobel Prize winner Dr. Muhammad Yunus, he come up with the concept, and not only Dr. Muhammad Yunus, there are many Nobel Prize winner, as well as many country representative, policymakers, government, corporation. They come up with this idea: vaccine for common good.
Oh,
So
yeah.
they want to, yes,
That's
vaccine
what
for
I'm talking about.
yes. Yes. So
Except they come with this idea, without any basis behind it. And what I'm saying is, at least it's going to be people like me who are not afraid to go against these big boys, the pharmaceutical multi-billion, gazillion, and people like Bill Gates and all these awful, unkind, uber wealthy people. And we are going to take this and unleash it to the people for free. We'll open source on the internet. Trust me. I have my people already looking at it.
How do you solve the distribution problem?
The distribution problem will be
Supply
solved
chain is a big
at the local level, because the distribution problem only exists if you expect your vaccine to arrive from Switzerland in a refrigeration at minus 60 degrees. That's what they are talking about, and you do not have that problem if you manufacture the vaccine in Congo, in Kigali, and have the people accept it immediately. So, my friend, forget the distribution problems for the rich. It's not for the poor. The poor should have it made on their own, and that causes, a true human response to an illness that devastates humanity.
No, one point I do not want to say in that way the poor has different problem, rich has different problem. Try to understand. Developed nation, they have strong dependency on the developing nations, the poor countries as well. Even though for the supply chain, even though what you wearing, example, maybe it's from the other countries, from the developing countries. What we eat, definitely from the agricultures. Actually, in the globalization concept, I think we need to create a very good ecosystem for healthcare system, for example, for education or for manufacturing, whatever it is. We need proper ecosystem. Example, if we think that China and USA has problem, it will not survive in the global economy, this kind of strategy. Why? Because example, I'm sure that maybe USA has a lot of dependency on China manufacturing. China also has dependency on US economy. Europe also same. So I believe that now the world is something like that we are living an ecosystem. How we handle the ecosystem properly, this is the thing. And COVID actually the challenging in this way. Actually, this COVID situation, like this ecosystem, the supply chain management, this kind of things may be interrupted. So this is very interesting. But I want to know the European point of view. Like Mr. Ikakako, how do you want to analyze the European strategy?
Well, I don't know. It's very difficult to analyze because in Europe, as you know, we have a very strong European Union, and European Union legislation and European Union is in. The other part of the population, for instance, here in Finland, are looking for this kind of United States of Europe type of model, which most of the bureaucrats in European Union also are willing to see, because they are getting high salaries from the European Union, highly paid jobs, and all this bureaucratic system what they are creating. And what Dr. Churchill said, I think this Hansean trade union and whatever it was in the early, like 200 years ago or something like that, that was really a model of free trade and taking care of everyone. But that's my personal opinion. Where European Union is now going is this kind of United States of Europe, and I don't like that myself personally. And this is also why in Europe at the moment there is a lot of resistance towards European Union. And you have probably read that there is a lot of this kind of nationalism, and they call it populism, but I call it nationalism.
Yes.
So those kind of parties are also having a lot of popularity in polls and in gallups and so on. So we are now balancing between the EU-minded people and the nationalist-minded people here in Europe. And that will continue, I would say. There won't be enough support for European or United States of Europe as long as I live or my kids live, probably. So I don't know. Europe is trying to keep the position what it had years ago when Scotland was the center of the Industrial Revolution, when England was really high on technology, and then when they had this colonialism, when they took all the other countries around the world and had this kind of colonialism and sort of thing. And many people in Europe, they are sort of living on that heritage still and not admitting what they have done. And I think that's my opinion, that Europe is sort of lost in a way, how it should collaborate between European countries and how Europe will be in a global scale. Europe is diminishing its power in global scale, that for sure. And it's very difficult for people and industries and businesses and populations to understand and I would say accept. But they should accept it and be more humble from now on.
Thank you, Professor Kako. I want to second what you said in a very important way. And what the example you brought of the Hanseatic League is vivid to me, because recently I traveled to Poland and some of the ports like Gdansk, as you know, was one of the vital parts of the Hanseatic League. Yeah. And then I went across to the other countries in a very quick fashion, Tallinn, and of course Estonia, Lithuania, all these small countries. And they proved to me one thing again, because I looked at the response in COVID and everybody was different, especially Sweden, and especially, the small old satellites of the Russian state, of the Soviet, Estonia, Lithuania, and they seem to be thriving compared to the rest of Europe, even under these conditions. So the reason why I do believe is this thriving economic as well as healthcare system of the old nations that belonged in that part of the Hanseatic League is because the foundation is solid. Because those 200 years ago, when you had the enlightenment of the people who could be just benevolent merchants and making, wealth out of the trading facility, but while taking care of their families and societies at home, is the model that allows these countries to exist in a successful way today, contrary to the rest of Europe, which is a bad copy of the United States. They try to model themselves after the United States, not of today, which would be an awful mistake, but they're trying to still do it at the time that they thought, United States was great, in the beginning of when they created the Federation of States. And that's another mistake, because they're forgetting to study the American history and the Civil War that followed, which was the most devastating war that this country has ever lived through. So if the Europeans are going for the same model, well, I say good luck to them, and I know that they will have to create a lot of clinics, for the refugees that they're going to stream out of the European civil wars to come and wars. The hegemony of Europe today, Germany, has also proven that they are inept, incapable, and unwilling to adapt to the realities, of the future in a position of benevolent leadership. Because, my good friends, the descendants of the Huns and the Goths and the Visigoths, my good German people, who occasionally they like the same opera I happen to like, the Nibelungen and the Wagnerian, amazing stories. They look at things in such a grandiose way that it always has to be a zero-sum game against the others. And I can tell you, the suffering that goes in the southern part of Europe today it is uncalled for from a very wealthy European Union of 500 million people. So I say the European example has been sunk like the Titanic, and the bureaucrats, of Brussels, they should similarly, be placed in a boat, and let go adrift into the Atlantic, for a few months and liberate the people. And then when they come back, they might come back to a new world, and they will have to get a job, to make a living instead of just lording it about, doing absolutely nothing and measuring the size of the bananas and the cure that they have so they can make them uniform, or trying to make uniform toilets, for the 500 million people. How awful, how awful. Let's wake up, really.
Yes, Mr. Jimmy, do you want to add, James, you want to add something? And beside that, I want to add two questions from Hosni Arafat. The third question is that what role can COVID vaccine play in restarting the normal lives? And Mr. Adnan's question is that how the developing countries get vaccine easily. I want to start with Mr. James, then Ika, and Dr. Churchill. Yes.
Well, I just wanted to misappropriate Dr. Churchill's imagery of the pyramid. And while we were at the top of it feeling fine, if the base is crumbling, we are not going up, we are going down. And so it is imperative to establish the base to keep it healthy so that those at the top do not crumble as well. And I think this is the basic message that I'm hearing and wanting to support. And if you can repeat the first question, I was concentrating on the second one.
Restarting our normal life with the vaccine. Vaccine can play a role.
This is because the second question goes back to the distribution problem, but as Dr. Churchill corrected me, this is if you do it locally, this distribution problem evaporates. So how do we adjust to a normal life? I don't know what the new normal will look like. And I think we have learned some valuable lessons about communities. And you start at home. And you take care of yours and those around you, and then your larger community. And then as your community gets well, then you can extend it to other communities around you. And this is the way to grow and to be healthy, is to start with yourself, keep your health yourself, then those around you, closest to you, and then to your community, and then to communities beyond you. And this is from the ground up way of healing and returning to a sense of normalcy. And I think that by paying attention to the health of others, we will also restore sanity to our medical and governmental systems as well.
Mm-hmm. Thank you. Mr. Ikakako, yes.
Sorry, I think I have to pass this question to the real experts. And as I said, Sharif, unfortunately, I have to leave. I have an appointment in the city.
No problem. Thank you.
For 1 hour. I would like to thank, colleagues and experts. Thank you, Dr. Churchill. Thanks, James. Thanks, Sharif, for this opportunity for me to have this insightful discussion, and all the best, and keep healthy, and bye-bye.
Thank you. Bye-bye. Take care. Yes, Dr. Churchill. Yes.
I wanted to thank my colleagues and, of course, you, Sharif, for being here. And I would like us to have an internal email so we can continue the discussion, of the record. But what I wanted to simply say today is we can, we owe it to the humanity, and not just to the children, that we have, but to the children of the world to come. And this is our covenant with people and with God. We have what we develop to bring to everybody on earth. And it's not going to happen through transportation. We see today China developing the vaccine in local areas and distributing it, not transporting it from the central government in Beijing to Lhasa in Tibet, which has 12 zones of difference, and they observe the central time of China. Not, my friends, it's not happening that way, and they certainly have understood that, because the Chinese bureaucrats tend to be more experienced, and having come from a revolution, they're certainly smarter, than the European or American counterparts, and they understand the power of the people when they get dissatisfied. So, they created centers throughout the country where the vaccine can be compiled, by sharing, the genetic information and just making it locally. So it does not need to be refrigerated in -60 or whatnot and to be transported. So that's one method. The second thing I want to say is that the good Chinese brothers, although they're exporting a lot of plastic goods and sharing in the global economy and giving us a lot of PPE of questionable quality and whatnot, they haven't sent a single dose of vaccine outside because they simply cannot keep up with the demand of their own country. So that places you, the bonus of understanding that our response as a global community is always for themselves, whether they label themselves as communist or socialist or democratic socialist or capitalist. It's always been, people looking at it as a zero-sum game because it changes the balance of the world and they're going to be in the leadership. So having a healthier population and an unaffected society and an open society, as China now very much is, they think that in a far better position in world affairs than what the United States could ever be, that we are still, going through the garbage of ideology, the garbage of response, of medical response, and the garbage of healthcare system, that they should all be flushed down in the toilet and it should start fresh. And the way to start fresh is going to be again the same. Not just have vaccines, have many vaccines, the best of the world, and allow people the choice to take one or another or take none, because we have already accomplished what we call herd immunity. And we should not be too careful now because only 0.02% of the people who are affected with this, they actually get to have serious complications. They don't even die because now we have good response. So we have other things developed, something actually my old university, Oxford, United Kingdom is developing, which is a nasal spray that you can spray in your nose once a day, and that attaches itself to the receptors of the virus in our body, and it closes them up so the virus cannot enter. And by doing that, once a day, you take care of yourself without having to have any vaccination. So we have to think imaginatively in other ways of protecting ourselves. Some other people are working on putting a little, ointment of a specific kind under the nose. And of course, by wearing a mask and you having an ointment to protect you, you will not get affected. So I'm suggesting that this whole talk about vaccines, knowing how the tuberculosis vaccine that we are working on for more than 15 years has not yet arrived. And some people, they're still talking about the old tuberculosis vaccine, which is completely ineffective and nobody's using it anymore except some very poor countries. But they are using the stockpiles that are being foisted upon them by corrupt pharmaceutical companies, and they're giving it to the people and doesn't even have the value of a placebo anymore because everybody knows it does not work. So do not expect a panacea when the vaccine comes. This is a myth. This is a pharmaceutical company's dream, to sell a lot of stockpiling of useless stuff that we put in our bodies, and many times it makes us much, much sicker than what if we don't have it. So my suggestion is, let's strengthen ourselves up. Let's try to take care of our people in every city, in every home. Say a few hugs, say some prayers in person. Open up the churches, open up the community centers, give people access to better healthcare for the soul and the mind, not just for the body. And forget all this talk about pumping more millions of dollars and billions and trillions and gazillions to the pockets of people like Mr. Gates and all the uber wealthy people who during this epidemic became extremely more wealthy. Like we've got all these billionaires in Seattle. My friend Bezos, the wealthiest person on earth, he increased his wealth by more than $250 billion just on this occasion alone. Same thing with Mr. Gates. He got up, on his bank account by another, 300 million or so, billion, forgive me. But after a while, these fools will understand that the numbers in their bank account do not matter because they will be judged in appropriate times when they face their maker and they shall be found wanting. And where they'll end up, maybe I suggest they should take up Dante and read about the purgatory of the old Italian philosopher poet. And they will find out that unless we take care of the people at the bottom of the pyramid who are ultimately our brothers and sisters globally, throughout the world, by open sourcing whatever medicine we have and giving it to everybody for free is the only solution to have a healthy population. And that's our only defense against these microbial organisms that attack the corpus of humanity, the corpus of our species, our body and soul throughout history and today. And I want to say thank you for inviting me in this discussion, but I'm going to close with a prayer of the Lord that says, look at the sun, and I will hold you in the palm of my hand and protect you. And yet, you have to walk towards the sun to reach the future that is promised for your children in benefit. And I will be there to support you. So, God bless you, and I thank you for this discussion. And I must say, onwards and forward, we have to beat this thing. And the best thing to do is hug the person next to you. Do not be afraid. God bless you. Take good care.
God bless you.
Thank you. Thank you. Thank you. There are more questions from the audience. I want to take more
But
questions from
I
audience.
must go because this is the time allotted for me, and I thank you, Sharif. Let's continue the discussion via email.
What a wonderful
Until then,
opportunity to meet you. Thank you
Thank
very
you.
much.
Thank
God
you.
bless.
Thank you. Thank
God
you. Take
bless.
care.
Thank you.
Thank you.
Thank
Take
you.
care.
Bye-bye.
Bye-bye. Bye-bye. I want to take Mr. Jimmy the two more questions. One is that my friend asking that what is the sustainable health strategy, and another one is that like how we can get quick recovery on our health inadequacy. So yes, this is the discussions we will do, and after that we will go for the concluding remarks.
Very well.
Yes.
So my again, I am a layman. I am not a medically trained expert on this field, but I think if I understood the question correctly, if we are suffering, how do we regain health? Is that what you heard, Sharif, as well, or
Yes. Yes.
yeah? Okay. So the idea, I think, is really well said by Dr. Churchill. You really want to think about others and what you can contribute to society. And when you are thinking along those lines, you will feel better. You will feel as though you have more health. And you will find that your spirits are lifted. And when your spirits are lifted, the body follows. And so you will regain your health if you regain your focus mentally on others, on helping others. And if you can get your spirits lifted and know that you can help others, you have the power to help others, and you start to do that. You bring a turkey to a food bank, you do something good for others, then you will find that you feel better.
Yes, thank you. Beside that, I just want to add one specific point about the health strategy, because we need to develop more doctors. We need to create more nurses. We need to create more hospital even for science and technology. Every country's the governments, even corporations, NGOs, they have to invest a lot of money for this development of healthcare system, and we have to careful about people. And beside that, what the important things I believe that we need to understand that how the developing nations get vaccine easily, how we can save more lives, how we can open up our economy, how we can go for the positive strategy, and which will actually help us to overcome from this situation. Even though this COVID actually very good learning for us, because many of the people, many of the country, many of the corporation, they do not have enough strategy for crisis management. This time we learn how we have to handle the crisis, how we have to work together, how we have to collaborate together. This is very important for us. And World Talent Economy Forum, we are knowledge hub. We're extremely knowledge hub. If you can see that all of our speaker like you, they're highly qualified, they're contributing for their nations, and they're contributing for the society. So we ensure the quality of work, we ensure that sustainable ecosystem, how we can work together, how we can grow together. We are arranging different kind of conference, seminar, we do research work. So actually World Talent Economy Forum, Asia Research and Development Academy, Al Noor Academy, and we have our school of talent economy. So if you have time, you can join in our school, you can teach your chess with our students. We can maybe 15 minutes to 30 minutes, but your 15 minutes to 30 minutes will be very effective and valuable for our youth community. Even I know that you are working in Africa, so any point World Talent Economy Forum can help you to for the African community. We are very, very much happy. And beside that, thank you for your contributions, and hopefully we will do work together, and by this way we can solve many things. Thank you for your valuable time and everything.
Thank you so much for inviting me, Sharif. I really
Thank
appreciate it.
Thank you.
I learned a
Thank
great
you.
deal today.
Thank you. Thank you. Take care. Yes.
Bye.